Hi, welcome to The ReadOut. We're here at the State Department with Ambassador Deborah Birx, who is the U.S. Global AIDS Coordinator. She has an absolutely fascinating resume and lots of relevant experience in public health and in the fight against AIDS and HIV. So I'm excited to welcome her here. Thank you so much for joining us. Ambassador, if we can start, can you tell us how you first became involved in the fight against AIDS and about your role as the U.S. Global AIDS Coordinator?
Great. Well, that was a long time ago, at the very beginning of the epidemic, before we knew that it was HIV, the virus, causing the disease. I was at Walter Reed, which was a hospital that was considered a tertiary referral center, and we were having a lot of young men coming in 82 and 83 with a very significant immunodeficiency, and I was an immunodeficiency expert, so they brought me in to try to understand what was happening, and none of us could really understand why a 35-year-old healthy soldier was now dying of immune deficiency. It didn't make sense. It didn't make sense for year over year. We tried everything to save them. We treated all the immunodeficient. We treated all the opportunistic infections. They came from all over the globe, so it wasn't that they were all exposed in a single source. It was very confusing, and we started studying all of the patients, and we never could really figure out what was causing it until they discovered the virus in '85. And then we realized within the military, probably at that time in the Army, we had almost 10,000 soldiers that were infected with HIV. And so it was a real awakening to how you've trained all of these years to understand everything about, well, you thought you understood everything about medicine, and you thought you had trained and become this competent doctor. And then you realize you can't save people. And that was such an humbling. And I think the people who were part of that original response to HIV/AIDS, we still feel totally inadequate because we lost so many of our patients, and we were trained not to lose anyone. And I think that's what drives many of us every day, to ensure that everything that we've learned since gets actioned right away to save more lives. And it's because we know the ones that we've lost, and we remember them every day.
Wow, what a powerful connection, this mystery that then has led you to your current role. So as the Global U.S. AIDS Coordinator, what does a day or a week look like for you?
It's exciting every day because every day we have a new challenge. We're very much into data, and we have data coming in from 50 to 60 countries, working with governments and communities to understand how the epidemic is evolving. Are we reaching everybody who needs to be reached? Are our prevention efforts working? So when you're in that many, we probably have 45, 50,000 sites that we're getting data in on a regular basis. We're always asking and answering, how can we be better at what we do? How can we reach more people? How can we make sure the program's more effective and efficient? I mean, we also know they're U.S. taxpayer dollars, and we take that very seriously. My parents, who are in their, one's 89 and one's 94, they're still paying taxes. So I ask myself every day, are we using their money in the most effective way? So that's exciting. We're always trying to save more lives, prevent more infections, and always ensure that we're doing it in a more and more cost-effective way.
And I understand for a lot of our viewers, they really do feel that bottom line, they're paying taxes, this is going directly towards prevention and treatment. I understand that it all falls under the umbrella of something called the President's Emergency Plan for AIDS Relief. We call that PEPFAR in the government because, you know, we always love to make everything into an acronym. Can you tell us a little bit about PEPFAR? I understand this is the 15th year of that plan. Can you take us through the history of it, describe its impact, and how you see it moving forward?
Well, remember those dark days in the 80s where we didn't know what caused the disease from this virus. Then there was all kinds of research that was done. So that by 95, 96, we had this cocktail in the United States and Europe that was a miracle drug. So if our patients made it to that time, they're alive today. Many of them are alive today. 30, 35 years survivors with this deadly virus because they got on the medication. Now imagine having that in the mid-90s and then realizing how devastating this virus is all throughout the rest of the globe. And I think when President Bush and the Congressional Black Caucus, who traveled to Africa and actually saw the depth and breadth of the epidemic. I started working in Africa in the late 90s, and so I got to see and experience it before Global Fund and PEPFAR. Imagine a third of the adults dying. That's what we were talking about. We were talking about a third of children not having parents. We were talking about child heads of households. We were talking about doctors and nurses and parliamentarians and teachers all succumbing to HIV/AIDS, and again, no treatment. And I think what our Congress and President Bush realized is that we had the tools to change the lives of people throughout the globe in low and middle income countries in a way that we did in the United States in really providing treatment through Ryan White and the other domestic programs we have here in the US. And so it was really a translation of the compassion of American people, but also believing we can do something bold. I mean, at that time, no one was on treatment in sub-Saharan Africa, maybe 50,000 people. And all of a sudden, President Bush announces we're going to put 2 million people on treatment. It was, to us, it was our moonshot. No one believed we could do it. Many people thought it was impossible. But what I've learned in being with PEPFAR, our teams and our governments that we're privileged to work with in communities, every time I think something's impossible, they make it possible. So I think that's what this response has really shown me, that when we see something that seems insurmountable, there are solutions we can bring and the tools, and if we utilize them correctly, we can change people's lives forever.
That's an amazing, just inspiring picture that you've painted there of really a dark day at the beginning of the epidemic, and you're talking about it with such optimism and hope and kind of lightness in your voice now. It's really extraordinary. I was wondering if you could talk a little bit about the DREAMS program. I understand that diagnoses among adolescent girls and young women are really one of the places that you're seeing a dramatic decline. Could you talk about that program and what you see as the future of the DREAMS program?
Well, the best thing about PEPFAR and what the original architects brought to the program was saying we were always going to be driven by understanding what we were doing. And so as the program evolved and we could see what we were doing, we realized that the group that was really under the most threat potentially of getting HIV positive were young women between 15 and 24. We also realized that all of a sudden we had twice as many of them as we did at the beginning of the epidemic. And this is really because all of the work that UNICEF and the United States and others did to improve child survival in sub-Saharan Africa, all of a sudden all of those under fives were now 15. And there were 70% or 80% more of them. And so we were seeing this incredible, what we call the youth bulge or the demographic dividend in sub-Saharan Africa. And we were seeing the risk of those young women as cars contracting HIV. And so DREAMS, Determined, Resilient, Empowered, AIDS-Free, Mentored, and Safe Young Women, really said that we have to bring a program that puts all those pieces together, that really brings that perspective of hope and living and being a successful young woman and not at risk for HIV, and keep young women HIV negative. And so DREAMS is focused in that way in 15 countries to really ensure young women can thrive. Now, everybody always asks me what we've done for the young men. So remember, we've had a program for young men since 2009, a prevention program for them that's been very successful. But we didn't have a really strong prevention program for young women. And so this administration, the past administration, and that's the exciting thing about the program, each president has brought a new aspect. Each Secretary of State has brought new insights into the program. And so really over the last 2 years, we've been really focused on young women and showing now through programming we could dramatically decrease their HIV risk. And I think that's the exciting piece now, to say that we have the tools to have a different future for young women in sub-Saharan Africa. And I think that gives us hope, not only of making sure everybody with HIV is thriving, but also ensuring that we decrease the number of new infections dramatically.
Right, and I think you're talking about really a whole of government bipartisan approach. I love the idea that, as you say, each president, each administration, each secretary has brought something new to the program, new to the fight, and new tools. I know that one of the things you've really worked on with your team is whole of government collaboration. I understand that you recently brought officials from the Department of the Treasury into the fight, and in fact that you convened finance ministers here in Washington. Can you tell us a little bit about that? Because I think for most viewers, they would say, Treasury, global fight against AIDS, how do those things connect? And I think it's really a fascinating element of your work.
PEPFAR from the very beginning was set up to capture the capacity of each of these different agencies within the U.S. government. And that's very exciting because it's one of the few programs that says, DoD, help us solve the HIV programs in ministries of defense around the world. USAID and CDC, help us work with governments and communities to ensure we have the most effective program. Peace Corps, help us bring all of that. And all of the HHS agencies that work on people who inject drugs and all of these other, the FDA approving our new drugs. It's intentional collaboration, bringing them all together. And over the last couple of years, we've brought in Department of Treasury in a very deliberate way because we realized we were talking health with ministers of health, but the people who actually control the budgets in country and make the investments are ministries of finance. They have a whole, just like PEPFAR is an acronym, ministries of finance have all their own acronyms. And so you can't have a health person talking to a ministry of finance without a translator. And our Department of Treasury, their work is with ministries of finance around the globe. And they have an incredible international program that works with countries around the globe to mobilize more resources and understand taxation and how to mobilize resources to ensure that the health and education of their populations. And so they've really helped us not only convene ministers of finance, but help us make the business case that says health is the best value. And that's really been very important because ministers of finance are trying to decide, do they invest in roads, do they invest in telecom, what gives them the best return on their dollars? And I think the Treasury is helping us along with the progress that we've made in the epidemic to really show that we are a best value. And investing in HIV/AIDS ensures that your nation thrives.
Absolutely. Well, I love that idea, and numbers are so critical to PEPFAR's success. But before we wrap up, could you talk a little bit about the personal impact, the stories that have really made an impression on you in your time as ambassador in this fight? I think for our viewers, it's really critical to take the big picture and humanize it, and I think you're uniquely poised to be able to do that.
Well, taking you back to Africa in 1998, so remember, I had lost so many of my patients in the early 80s by this devastating disease. Young, healthy men dying of HIV/AIDS. It's a very painful, difficult death. And now imagine going to Africa to work on an HIV vaccine and seeing that in community after community. Wheelbarrows of individuals brought to the health center and the district hospitals, and the matrons who really control the health access in that area standing at the gate and saying, we don't have anything for you. And families being turned away with their loved ones dying over and over again. It was just to see that and know that you have the answers, and then go early on in PEPFAR with the clinics that were created. You would walk through the clinic and everyone was looking at the ground because everyone was so ill that they had spent their last energy getting to the clinic where hope was and getting on drugs, and then seeing them a year later, everybody's chatting and having a great time in the clinics. And if you go to any clinic now in sub-Saharan Africa, you will see joy and you will see success. And I think knowing that that's what the American people did, they transformed not only the lives, but the community and the social fabric of sub-Saharan Africa is protected today because of their investment. And where there used to be just absolute despair, there is transformational hope. And every one of those individuals and every minister of health and every government knows that that's coming from the American people. And so although they can't see the individual who gave the funds, they always thank the American people for their generosity, because I think they're still stunned to this day that we have that ability to help at such an extent as that, and they really are so deeply grateful. Communities and generations will never forget what the American people did.
Well, what an incredible note to end on, that message of transformation and hope. Kudos to you and your team. I hope
It's a team.
It is a team, always. I hope we can do this again. We'd love to have you back on the Readout in a year, where we can talk about the strides that PEPFAR's made under your leadership. Thank you for your time. Thank you so much to our viewers. This has been the Readout from here at the State Department.